Our Live in the USA segment is all about helping you feel prepared for the everyday details of your new life. Today, we're focusing on transportation. Getting around the US can look different, depending on where you live. So to walk us through the key things to consider, I'd like to welcome Nick from our International Employee Supervisor team. Hi, Nick.
Hi, Melissa. Thanks for having me. Super excited to cover this today. So let's just dive right into it. So transportation is a critical part of daily life in the U.S. and it impacts your ability to get to work, run errands, and settle into your new community. Unlike many countries, the public transportation is not always reliable and widely available in the U.S. So planning ahead is key. Our team is here to provide you with full circle support to give you a guide for your transportation options and help you as you arrive. So let's start by looking at public transportation and what you can expect in different U.S. cities. Public transportation systems vary widely across the U.S. Some cities offer reliable options while others have very limited services. Large metro areas like New York, Chicago, and Boston often have subways, buses, trains that run frequently. Smaller cities and rural areas may only have a few bus routes with limited hours, which can make commuting more challenging. In the U.S., taxis are not common outside of the big cities. While apps like Uber and Lyft are available in many places, they can be expensive and unavailable in those rural areas. A key takeaway for everyone is that public transportation in the U.S. can be very different depending on where you live. Some cities have strong systems, but many have limited options, so planning ahead is essential. For many international nurses, public transportation may be difficult. May not be reliable enough for daily commuting, and that's why car ownership often is the most practical choice. A car allows you to control your commute, work differential shifts, and access grocery stores, schools, and healthcare. Some factors to consider before buying a car are cost, financing and loan options, insurance, gas, and maintenance expenses, whether you have a U.S. driver's license or need to apply for one. Having a car is an investment, but in many locations, it is necessary to ensure you can get to work on time. One key takeaway is that while buying a car is a big financial step, it is often the most dependable way to manage life in the U.S.
Nick, if I could interject, I definitely do believe having a car is definitely dependable. I mean, if I could think back to my time, when I first came to the United States, my goal was, not to drive. I was scared of driving. So I thought I would be the perfect passenger princess, right? But then that was pre-COVID. So fares were fairly reasonable. Then after COVID, the prices kind of went up. So it was a little bit hard and expensive for me to get, to and fro work. So I was like, okay, let me get the fare aside and, get my driver's license and get me a car. And surprisingly, what I was paying for Uber was, and what I paid for my monthly car note. So my monthly car note was less than what I would pay for Uber. So sometimes it really does depend, like you mentioned earlier, on the location for whether you decide to get a vehicle, whether it's better to get a vehicle or it is better to go the public transportation route. So I would say it's probably better to be safe than sorry. So if you're scared of driving, still go get that license. You may never know. Back to you, Nick.
Yeah, and for many of our international nurses, public transportation, with the ownership of the car is definitely the best way to go. So let's see. So if you decide that owning a car is the best option for you, we should definitely explore these different ways that you can purchase a car in the U.S. There are multiple ways to buy cars in the U.S. depending on your budget and preferences. The first option is International AutoSource. We refer to this as IAS. This works with international nurses without U.S. credit history. This offers you a brand new car with no credit check required, provides a free rental for 45 days while you wait for your purchased car, and it delivers to all 50 states. So this is definitely a very good option for convenience, especially getting that car right after you arrive in the form of a rental. The second option here is our Advancial Credit Union. They provide auto loans for both new and used vehicles, allows you to purchase a car from any dealership and requires some processing time. So you would need to plan ahead for this. And it does not include a free rental car. So temporary transportation is needed. Again, the one really big perk on this one is that you can get a used car, so you don't necessarily have to purchase something brand new. And usually those are more affordable. You can buy a car in cash. That can be done through a dealership or private seller. This avoids loan interest, but it requires a lot more money up front. Renting a car temporarily is useful while searching for a car, but it does require a major credit card to book. And then ride sharing, obviously. So Uber, Lyft, these can be useful for the short term, but may be expensive or unavailable in some areas. So definitely, planning ahead and figuring out your best options in the area is definitely key. So owning a car means more than just buying it. You'll need a driver's license and must understand the responsibility that come with car ownership. So in the U.S., you will be required to get a local driver's license, and I'm going to cover how to get your driver's license. Most states require you to get a driver's license within a certain time frame after arrival, and that does vary by state. So once you do arrive, you can reach out to your IES and figure out, what that time frame would look like. If your state allows international driver's permit, you can use it temporarily, but you will eventually need a local license. So the steps to getting your U.S. driver's license, first is obtaining your Social Security number, which is needed for most applications, but not all of them. Again, they do vary by state. Pass a written exam and on the on-road laws for the U.S. Take a vision test, and then pass a behind-the-wheel driving test. Typically, there are associated costs with this, and these do vary by state. And you'll need to check with your local DMV for the exact prices. But typically, a written road test costs anywhere from $20 to $50. The license application fee is $30 to $90, and driving lessons, if needed, are usually $40 to $80 per session. And then here, I do want to cover some car ownership responsibilities. If you are driving a car in the U.S., you're responsible for keeping up with regular maintenance, such as oil changes, tire checks, and then also understanding U.S. driving laws and road signs, and ensuring that you have proper insurance coverage required by your state. There are also different child safety laws and car seats. U.S. law requires children under the 8 years old to be in a car seat or a booster seat. Car seats must meet U.S. safety standards, which may differ for those in other countries. Even if you are using Uber, Lyft, or a taxi, you must bring a car seat for young children, as these services do not provide them. We can assist in purchasing a car seat before you arrive, and your arrival coordinator will help install that properly. Some key takeaways here is that both driving and owning a car in the U.S. come with legal responsibilities, and knowing the rules ahead of time helps keep you and your family safe. Before driving in the U.S., it is essential to have a transportation plan in place so you can get to work on time and adjust in your new life smoothly. So before you arrive, you'll need to complete a transportation declaration form. This tells you how to plan to get to work once you're in the U.S. Your options include owning a car, and as we mentioned before, that can be through IAS, Advancial, or a cash purchase, renting a car, or relying on Uber and Lyft or public transportation if available in your city. If you are unsure which option is best for you, our team can help you guide based on where you'll be living and working. Key questions to ask yourself include, Is my assigned location walkable? Is public transportation reliable? Can I afford a car or will I need financing? What's my backup plan if my first option doesn't work well? Because obviously, when you do drive a car here in the US, there are the unexpected things such as breakdowns, flat tires, anything like that. So you'll definitely want to make sure you do have those backup plans. And just overall, it is important to have a plan in place before arriving in the US to ensure that you can get to work on time. Here, you'll want to make sure that when you walk away from this, that you have a plan in place for your transportation before you arrive here. And being prepared ensures that you get to work reliably from day one.
Awesome, Nick. I do want to interject a little bit. So I recently learned that Uber and Lyft and taxis, they don't always provide the car seats, but in some cases, especially in larger cities, they might. So that's definitely something for healthcare professionals to know as well, and just kind of jot down that it's possible in larger cities that they might provide the car seat. But you can always be, like I said, safe than sorry. So you could potentially bring your own if needs be.
Yeah, definitely. And like you said, just to echo that, it's better to be safe than sorry. So if you are using Uber or Lyft, bringing that car seat or booster seat is definitely a must before you take those rides. And then one last thing, just a couple of things here before we wrap up. There are a few key takeaways from today's Life in the U.S. segment on transportation. So one being transportation in the U.S. varies depending on where you live. So it's important to plan ahead. In many cases, owning a car is the most reliable option for getting to work and managing your daily life. There are several ways to secure a vehicle, and each option comes with different considerations. Driving comes with responsibilities, so understanding the rules and preparing early is essential. And most importantly, having a transportation plan before you arrive sets you up for success. And as a part of our full circle support, our team will guide you through every transportation step, helping you choose the best option for your location, prepare for your commute, and feel confident getting to work from day one. Thanks, everyone. That's all I had.
Awesome. Thank you so much, Nick, for kind of running through what transportation looks like and what to expect, when a healthcare professional gets here. There are different options, like Nick said, there are car ride share services like Uber, Lyft, taxis, or you could choose to go, buying a car. We do have means to help you to do that, whether it's new or used. So there are plenty of options for you. So I definitely would suggest, making sure that you're reaching out to your assignee or recruiter so they can talk to you more about what these options look like. So thank you so much.